here. We're going to jump back over here and start it out. And just relax.
What are you working on right now?
Right now I'm doing the one arcade, the one cheek arcade, getting the sharp points off the buckle, lingual, palatal side of all the arcades, and then making sure all the molars and arcades are in balance. In the past, Naaman's had rostral hooks and caudal hooks, aberrant teeth, and what was called excessive transverse ridges. Right now, most of that is all gone. There's some residual effects, but what we're going to do is we're going to keep treating them a little bit at a time, because you can't take down everything too far, too much, or else none of the molars will touch one another, and you won't be able to masticate or occlude. So he's a little bit nervous, but he's really been a good boy, and we're just taking our time, being real gentle with him, going real slow, and he's just reacting really good. Now the purpose of having all the arcades in balance is very similar to your car. Like we did the incisors first, and then we put them in balance, and now we're going to put the cheek arcades in balance so that the front and the back, just like the tires on the front of your car and back of your car, are all equal, and you ride better. He's going to be able to occlude better, masticate his grain, get all the nutrients out of it, and just feel overall all better. His weight, I mean, he's just tremendous. He's a good-looking boy. He's heavy, you know, not fat, but just real muscular. And that's from him getting all the nutrients. And we just want to make sure he has no oral pain, no discomfort. And lift up just a little bit. There you go. Now we go on the palatal side of the upper cheek arcade. And we have to be real careful here, because running along the cheek arcade molars is the palatine artery. And the palatine artery, if he was to jump real quick with these sharp blades, it could pierce it. And if we pierced it, it would cause a little bit of bleeding and discomfort, nothing earth-shattering, but we just like to be real careful. I put my hand in, and I'm actually covering the artery and using my hand as a guide. Just jump it around a little bit because I don't want him to get annoyed on any one side. And yet we want to cover all four arcades from the 06s all the way back to the 11s. There we go. Good boy. Okay, I got one spot back there and nothing over here. Now to get that upper 11, 111. This is called an M3. It's only used on these two teeth, the 111 and 211. And it goes way behind and grabs hold of that big sharp hook. And I know, honey, I know. There we go. Okay.
Sounds like it broke.
No, nothing broke. This is just the actual shaft hitting the speculum. We're always smelling, and people laugh, but that's the best way to determine if there's any caries or any periodontal pockets or decay within the molars. Of course, he is perfect. He has no foul odor, he has no periodontal pockets, and all his arcades are really doing well. He is missing one canine and has been missing that for quite some time. It's a 404. Not causing any problems. It's not used in the mastication process, not used in the occluding process, don't need it to ride, but it just noted that it's not there. It's not subgingival. It may have been trauma as a youngster. It could have never developed. There's all different reasons. It doesn't cause a problem. Okay, Danny, I'm going to go way back now. Ready? I know, honey. I know. It's me and you. It's me and you, baby. Right there, honey. Yeah, right there. That's all it is.